Thank you, Madam Deputy Speaker. Can I echo what a beautiful maiden speech that was from my honourable friend from High Peak? Well done indeed. I'm going to be rather novel here and speak about the bill. But before I do that, I just thought the package that's been announced thus far in the budget and last week is incredibly welcome. But can I echo what so many members have said in the House so far today? The self-employed next, please, because we are desperate, many of my constituents, for the government's help. Madam Deputy Speaker, I rise to speak in support of the bill receiving a second reading. Nobody, of course, wanted to be here, but this is an essential and urgent piece of legislation. We may be discussing the coronavirus bill today, but for some, this is in large part the flu pandemic bill, which I was very much involved in when I was fortunate enough several years ago to be the Public Health Minister. Now, this legislation, Madam Deputy Speaker, won't make COVID-19 suddenly vanish, as President Trump bizarrely proclaimed the other day, but it will help the state and our government do what it has consistently stated is its primary objective here, which is to protect the NHS and save lives. As the Secretary of State made clear, these are extraordinary times, and these are measures pursued as a result. But I think, because I too have had lobbying this weekend saying that this goes too far and it's disproportionate power grab from the government, I think it's worth saying these are not measures dreamt up on the hoof by the Secretary of State over the last week. The UK Influenza Preparedness Strategy of 2011 set out our preparedness for a severe pandemic. It was tested through a major three-day exercise called Cygnus, involving about 1,000 organisations as well as the devolved administrations in 2016, and that demonstrated a number of things that we do well as a country and a number of things that we need to improve upon, one of which was the drafting of the draft pandemic influenza bill, which forms the basis of the legislation today. So the scrutiny we're giving this legislation on the floor of the House is not what we do in normal times, of course, but these are not normal times, and Parliament needs to work swiftly with deftness of touch to match pretty much everyone else right now. I have to say I am satisfied the legislation, as was always intended, is time limited, and it makes clear that it is neither necessary nor is it appropriate for all of these measures to come into force immediately. What's more, the lifetime of the Act can itself be ended early if the available scientific evidence supports that, and we can extend the lifetime of the Act for a further temporary period if it's prudent to do so. Let me just turn to a couple of areas I want to home in on, if I may. Obviously, increasing the health and social care workforce is mission critical, so the bill introduces the new registration powers for the registrars of the Nurse and Midwifery Council and the Health and Care Professions Council. That's absolutely right, but I think we just need to hear from ministers, as indeed mentioned in the impact assessment, exactly how the HSC plans to engage with the professional regulators to ensure that sufficient infrastructure is in place in order to implement the policy. Also, I note the sensible move to allow the early registration for final year students studying to become nurses, midwives, paramedics and social workers, and the government's assumption that all 28,100 students estimated to be in their final year studying these professions in England will be willing to join the register early. So I would ask what evidence we have that this is happening or likely to happen, and also are the costs noted in the impact assessment covered so as to give total confidence to the regulators that they can get on with this. On food supply, I'm very pleased that DEFRA holds responsibility for food as a critical national infrastructure, and working with the Food Standards Agency, it has to, of course, maintain our high standards, but I have to say I don't think this legislation goes far enough in protecting stock on the shelves. Like all of us, I've had hundreds of constituents contact me in the last few days on many different subjects, but consistently coming back at me is the jarring between what they're hearing from ministers and the supermarkets about being there enough food and what they're seeing on the ground, or more importantly online, when they try and book a slot. Now, of course, the government is not to blame for a change in our food policy from the sort of dig for victory in the last century, backed up by local food networks, to a very centralised distribution controlled by the big five supermarkets that we have now. But how sad it is, Madam Deputy Speaker, that we've literally put all our eggs in one basket, and how we're reaping what we've failed to sow now when we need it most. Finally, on the subject of volunteering... Yeah, sure.
I'm very grateful to my old friend for giving way. He's making a very good speech on different aspects of the bill before us, but on the first point he touched on, which is the issue of how we manage to give reassurance to the self-employed, does he agree with me that there will be no single scheme which covers every situation perfectly, but the crucial thing at this moment is the reassurance that there will be something done to help everybody who is self-employed?
Bree, and I understand why we had to do those through PAYE first, because employers were making decisions about job losses this weekend. But I completely agree, we need to hear something from the Prime Minister, and I understand he's going to be addressing the nation this evening, and I think we can probably all guess what's coming, but he could say something very reassuring to people who are self-employed and sole traders this evening. I think it would be very welcome. I just said finally, Madam Deputy Speaker, on the subject of emergency volunteering leave covered in clauses 7 and 8, I think it's very welcome unpaid statutory leave the Secretary of State mentioned earlier on. Clause 8 says the Secretary of State must make arrangements for making payments to emergency volunteers by way of compensation for loss of earnings and for travel and subsistence. So could the Minister, in summing up, tell the House at what level that might sit? We seem to have an 80% norm when it comes to the coronavirus job retention scheme, so are we looking at the same here? As I say, I think that's a smart move. Many of our volunteers come from the older generation, so we've got to find a way to fill that gap. In closing, we need ruthless, determined, collective action to protect the NHS and save lives, combined with scientific progress. And this bill is part, but I have to say only part, of that national effort. Now, I've listened very carefully to the many voices lobbying us around the bill this weekend, but I am comfortable that it is a well-judged piece of legislation that provides the powers needed to respond to this epidemic and this pandemic and this national crisis that we face at this time.
David.